Welcome back to another channel. So today we are learning fibrosarcoma. So it is a malignant mesenchymal tumor. So tumor of mesenchymal origin, as I have told you, osteosarcoma. Similarly, composed of malignant fibromas. There was malignant osteoblast, right, in a collagenous background. So it is a tumor of the mesenchymal origin which composes of malignant fibroblast in a collagenous background. So first there is a soft tissue mass, and second there is primary or secondary bone tumor. So in this tumor there is a soft tissue mass, and there is primary or secondary bone involvement or bone tumor. Increase. So infantile variant is for less than 10 years if there is an infantile variant. Okay. These are the types. So if I talk about the clinical features, site is skin, either it's the skin or it's the deeper subcutaneous tissue. So as I told you, the skin, there is hair, everything, or it is inside, it is the deeper subcutaneous tissue. The muscle tendon could be affected, and the periosteum of the bone. So this is the bone. The periosteum of the bone could get affected. So since we are talking about the mouth, we'll talk about the intraoral sites. It could be the cheeks affected, the buccal mucosa, the maxillary sinus, the pharynx mucosa, the labial mucosa, and the palatal mucosa, the periosteum of the maxillary and mandibular alveolar bone. Okay. So what will be the age? It is 20 to 40 years of age where you are most of the people manifest with this symptoms, which I am going to tell you about, and less than 50 years of age. Okay, sex is, males are more prone to have, so there is a slight predilection for male as compared to females. There is rapid or slow growth. So either the fibrosarcoma is rapid or slow growth. It is locally invasive to produce a fleshy, bulky lesion. So there is rapid or slow growth, and it invades locally at one site to produce a fleshy, bulky lesion. Okay. So what do you have in that lesion? You find ulcerations, hemorrhage. Ulceration, you know what is an ulcer, right? Hemorrhages, and then there is secondary infection. When you find hemorrhages, so the ulcerations is basically the growth of the tumor is so fast, so rapid that the blood vessels cannot cope up with that, and therefore you have hemorrhages and ulcerations. Okay, and then it could be secondarily infected. Then you will have elongated retipex. Okay, if it's secondarily infected, systemic. So there will be asymmetrical swelling. Now, since there is, if we are looking at the face, so there could be asymmetrical swelling, there could be distortion of the face, and in primary bone tumor, I told you primary or secondary bone tumor, it is central, which is within the medullary cavity. So there is a medullary cavity over here. So the tumor starts within the medullary cavity, or it's peripheral arising from the periosteum. So either it's within the medullary cavity or it's from the periosteum, it goes inside. In secondary bone tumor, it arising from the pre-existing lesion and follows radiotherapy to bone and soft tissue. So there is already a pre-existing lesions, and you give radiotherapy, and it spreads to the other, follows radiotherapy to bone and soft tissue. Okay, so this is more aggressive than the primary bone tumor. Okay, secondary bone tumor is more aggressive and it has poor prognosis. Understood, right? There is primary bone tumor and secondary bone tumor. Primary is either central within the medullary canal, or it is from the periosteum, and secondary you already have a lesion, and then the other bones are affected. Okay, follows radiotherapy, right? Either it could be following radiotherapy. Next, we come to the idiopathogenesis. How does it happen? So there is no definite cause, but there is genetic mutation which is seen. So genetic mutation, you have to remember fusion transcript. in the fusion transcript. So there is genetic mutation in the fusion transcript, or there could be translocation. So in the translocation, you have to remember T1215, okay, T1215 or TP13Q25. So remember T fibrosarcoma. So 12 to 15, just remember. So translocation from 12 to 15, or there could be translocation from P13 and it goes to Q25. I wrote G over here, it's wrong. Q25, okay. So if it's difficult, just remember 13, 25 and 12, 15. These are the translocation. Now, giving rise to I told you there is mutation in the fusion transcript, right? So what fusion gene? It is the ETV6-NTR-K3 gene. ETV6-NTR-K3. So either if you don't remember, just remember ETV6-NTR-K3. So to remember this, I had made a mnemonic. This you have to remember. So either you remember by mnemonic or you just by heart it, learn it by heart. Then you won't forget. So ETV6 is extraterrestrial vehicle 6. You remember ETV6 extraterrestrial vehicle 6, and then MTR you remember by MTR. I don't know. I just remember MTR somewhere. MTR masale. And K3 is Three Kings Church in Goa, if you know. So there is extraterrestrial vehicle 6, MTR, and Three Kings came when Jesus was born. So remember like that. Extraterrestrial vehicle 6, ETV6, MTR. So remember NTR. You have to remember NTR. As MTR you have to remember, but right, NTR and K3. So this is the gene fusion. Now what is ETV6? It's an oncogene. So the name is actually ETS is erythroblast transformation specific, and NTRK is neutrophobic tyrosine receptor kinase. If you have very good memory, then if you can remember this, might as well. But I think this much is enough because I will remember this much only. So I have just written extra information which you don't really need. Then if you talk about the histopathology, so histopathology, what will you see? You will see proliferation of fibroblasts. It's a fibrosarcoma. Plus you will see what? Formation of collagen and reticulum. So either you have first proliferation of fibroblast, and then you have the formation of collagen and reticulum, because fibroblasts do that only, right? So the fibroblasts will produce them. So you will have well differentiated, resemble normal parent tissue. Sad, just like normal parent tissue. This is one. First one is, there are types of fibrosarcoma. First is well differentiated, where the fibroblasts resemble normal parent tissue, okay. And then there is intermediate, where you have cellular, there is more cells, and then you have this herringbone pattern or chevron pattern, and you have parallel sheet of cells arranged in the intertwining walls. So you will have this pattern. This is known as chevron or herringbone pattern. So you will have 1, 2, 3, 4, 5, like this pattern of fibroblasts here. This is in the intermediate or the cellular phase, okay. And then you have high grade. So you have well differentiated, intermediate, and high grade. Well differentiated, normal parent tissue it resembles. In the intermediate you have cellular herringbone pattern, and in the high grade you have mitotic figures, bizarre in a highly anaplastic growth, and you have very cellular abnormal mitotic figures. So cells are spindle shaped, the fibroblast, with elongated nuclei. So you will find fibroblast with elongated nuclei, associated fibers arranged in interlacing fascicles. So all of these are arranged in an interlacing fascicles together or bundles, and bands run in different directions. So one is going this side, other one will go this side. So they are interlacing fashion. So they are cells of the spindle shaped and elongated nuclei associated with fibers arranged in interlacing fascicles or bundles, and bands run in different directions. spiraling appearance is seen. No tumor osteoid is found in fibrosarcoma. So what will you think of it? The differential diagnosis looking at the histopathology. You will think of fibrous dysplasia, fibrous histiocytoma, osteosarcoma also could be thing like fibro-osteosarcoma. Paget's disease, liposarcoma and rhabdomyosarcoma and neurogenic sarcoma. These are the differential diagnoses you have to remember if you can. Just remember 3: fibrous dysplasia, then you can remember osteosarcoma and Paget's disease. 10% risk patients, previously history of these 10% risk patients, they can develop fibrosarcoma further in their life when they have previously history of fibrous dysplasia, chronic osteomyelitis, bone infarct or Paget's disease. Okay, so if they have any of these, then they are at 10% risk. Then if I talk about the treatment and prognosis, primary fibrosarcoma of bone has worst prognosis than osteosarcoma. So primary fibrosarcoma, I told you, of bone, worst than osteosarcoma. 5-year survival rate is 65%. High grade 10. This is of primary. Okay. High grade 10-year survival rate is less than 30%. In secondaries, secondary fibrosarcoma 10-year survival rate is less than 10%. Okay. In primary fibrosarcoma, it is 65. In high grade, it's less than 10 years is less than 30%, and secondary fibrosarcoma 10-year survival rate is less than 10%. So this is not that important. So what you will do is radical surgery including removal of the potentially invaded muscle or bone if you have the fibrosarcoma, right? And remember, the prognosis is not. Yes, that is it with fibrosarcoma. I will give you how it looks in what to draw. Okay, so I'll show you if you want to draw. So this is the chevron pattern you have to draw. So you have pleomorphic fibroblast herringbone pattern. You have to mark it fibrosarcoma, and in this pattern you have to draw. You see this. Okay. You see the spindle shaped nuclei. Fibroblast, and you have to draw elongated nuclei with them. Draw the nuclei. Yes. And see the pattern over here. Like this pattern, you have to draw it everywhere. So this is with it. Thank you so much for listening. And let's meet in the next video. Thank you.